Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Posture and Chiropractic Clinic. Let's talk about the part of your spine that hardly ever gets addressed, the front of your vertebra. I'm here with Ian, and we're going to demonstrate to you some of the things you need to keep in mind. This comes in super handy with headaches and neck tension, so stay tuned. All right, so you've got your spine. Ian sitting here. That's in, that's the front, that's the back. That's where the bumps, if you run your fingers on the back of your body, neck, lower back, whatever, you will feel these bumps. So now, this is a Manaphy's vertebra, but same principle. This is the front, that's the bumpy part. When you go see a chiropractor, as an example, or whatever that is being done manually on your spine, typically addresses the surrounding areas in the posterior side, in the back area, not the front area. Especially, obviously, in the front, we've got the whole internal organs. Over here, you can't even get there because it's covered by the chest cavity, the ribs. And in the spine and the neck area, it's all the throat area that is covering this soft tissue. However, if I approach it from the side, I can actually get to feel these areas very cautiously. I have to warn you, this is not, you shouldn't just go in there and start digging in, because you've got some crucial blood vessels there that you don't want to mess with. So that's a heads up warning. And I noticed on Ian, as I was doing my adjustment, that there was something that was just not moving properly that alerted me to check it out. So Desiree, come on back here so everyone here can see what I'm doing. So this is his spine. This is all the, Ian, can you hold on to this? Yeah. Can you hold on to that on the other side? So that's this area. I'm going to the side over here. That's here. I'm gonna get there, and now if I turn, Ian, turn your head so they can see that. If I turn, that he's turned, this is that area, and this is about the front area. So now I'm going to take that away from you so your arm's nicely rested. You're going to be there. I'm just going to approach it from there and get right behind a whole bunch of muscles in the front and right there. It's much easier when you lay down. So go ahead and lay down, Ian, for me. Bend your knees. I was on the other side, but I'm gonna be on this side, on the right side now. I'm getting right there. And I'm really feeling the soft tissue. Ian, are you okay? Mm-hmm. If you feel dizzy, nauseous, or anything like that, let me know, and that's your cue that you're cutting off blood vessels. So not a cool thing to do. Is that sore a little?
A little sore.
I'm gonna go there. You're still okay?
Still good.
Now I'm gonna go from the front. Right there. Are you okay?
Yep.
A little more sore, or are you still the same?
Still the same.
And right there, you're good?
I'm good.
Okay, so what I'm really feeling is I'm looking for any, I'm gonna call it gliding. So I'm gonna move over this way. So there's this structure called, well, technically, I guess it's called a structure. It's called fascia, fabric of life. So it goes up over and under every part of your internal body parts. So between muscles, soft tissue in general, there's fascia, and if there is not a nice gliding, it's too much friction, so that restricts the movement. We do want to induce movement there. It should never not flow. So on Ian, and I know Ian's history, he's definitely played it rough, played sports roughly, wouldn't you say?
Yeah. A lot of contact.
Right, and you played what sport in high school?
Shot put and discus.
Shot put and discus, and you injured your wrist
Yeah,
and your shoulder.
I did.
So we already have that. Are you okay there?
Yes, I am.
Okay, so I'm just comparing the two sides here, which is hard. This is probably boring for you guys watching, but I want you to kind of see what happens. A lot of times people are fascinated by what happens in a chiropractic office, and not every chiropractic office does the same things, by the way. So this, are you okay there?
I am.
So I'm really trying to see how the soft tissue is gliding as I'm making my movements there. Highly important. Not one of those things that get assessed when you get crack out the door, right? So these are some of the soft tissue assessment that has to take place in everyone, especially with people with neck tension, headaches, because they do cause those. Anyway, I hope you got something out of this. If you have any questions or comments, make sure you, that's not a good one. Make sure you contact me, and thanks for watching. Take care.